you all for joining today. My name is Anthony Haro. I'm with Low Country Homeless Coalition in Charleston and the surrounding counties. And I'm also the chair of the South Carolina Coalition for the Homeless, which is our statewide homeless coalition. And today we have some great people who have prepared an excellent training for PATH users and people using HMIS to make sure that that data is getting entered correctly and that we can continue these programs in South Carolina. It all hinges on good data and making sure that we keep track of that, our great work, just as well using HMIS. So you're in good hands with these folks, Kyle, Helen, and Natalie. And also, I just want to put out there too that we are your resources. I'm sure that the trainers will hit on this as well. But if there's ever questions that you're having about the right way to enter data for the PATH program, please do not hesitate to reach out to your local administrator. It's much better to get the story right than enter in bad data and then have to go back and clean up a lot of work later on. So it's best to ask up front, and hopefully this webinar will cover a lot of the questions that you might have. But it's also intended that this is an ongoing relationship as well. So I'm going to pass it off to Ms. Michelle Murph with South Carolina Department of Mental Health. I know she wanted to open up as well. So, Michelle?
Great. Thank you so much, Anthony. Well, first of all, I just want to say thank you so much to the State Coalition State Data Committee. This has been an ongoing process to make sure we had the correct workflow in HMIS. It's been lots of work, lots of tough work actually, to get this to come to where we are today with this webinar. And I just really appreciate the work and that work, but also planning this webinar, which I know took a lot of effort. And I know it's a committee effort, a total committee effort. And that's the committee made up, primarily of HMIS admins from each of the 4 coalitions. So a big shout out to Anthony, Kyle, Helen, and Natalie, and their staff. So let's go ahead and do a real quick roll call. The agencies that were invited to participate in this webinar were our 4 new PATH providers. We just awarded our new contracts for this federal fiscal year that we just started this fall. And they are, in alphabetical order, Greenville Mental Health Center, Mercy Mental Illness Recovery Center in the Midlands, 180 Place in the Low Country, and Waccamaw Center for Mental Health in the Echo region. These are new regional PATH providers now. That's the way we structured our PATH program this year, and how we structured it in the request for proposals that these agencies responded to, and were successful in receiving awards. And that is a little bit of a twist. It's a little different, but we're excited about that. Because theoretically we're covering at least most of the state to the greatest extent possible. So let's do a quick roll call to make sure we know who's on the webinar. I think that's always a good practice on these types of training sessions. So Greenville Mental Health Center, can someone let me know who is representing Greenville today?
This is Vaughn Reynolds. We also have James Butler and Kim McNeil with us.
Great. Okay. Excellent. Mercy Mental Illness Recovery Center here in Columbia.
The outreach team and Francis Everingham.
Great. Okay. And we're representing Mercy today, right?
Correct.
Okay. Good. 180 Place down in Charleston. Who was on the webinar representing 180?
Chris Mengesser's on the call, just listening.
Okay. All right. Good, Chris. Thanks. I think Margarita has I see her name on the webinar.
She's on mute. But
oh, she's probably on mute. Okay. But I know that I talked to her earlier, and I know that she's getting on this webinar. Good. And Waccamaw, last but not least, down in Myrtle, covering the Echo region. Waccamaw.
Can you not hear me now?
Right. Is that you, Margarita?
Yes, that's me.
Okay, good. Okay.
You can hear me?
We got you. Well, we can now. Right. And Waccamaw region again. My understanding was that Cicely would be joining us. Is she on the webinar? Okay, maybe not. All right. Well, good. Well, we'll go ahead and turn this over back to you, Kyle, to go ahead and get started.
All right. Just to echo what they said, we really appreciate everybody's time for getting on the call today. This has been a complete committee from the state South Carolina Coalition for the Homeless. It's been a data committee. The complete team has been working on this for about a year or so now, and we've had lots of challenges, but we feel like we've overcome those challenges with the help of our contractor, Bowman, to be able to provide you guys with what we feel is the easiest workflow for PATH. We don't have many choices in the way that we can do the workflow. Those are kind of made for us from the federal level, but we can introduce ideas and different tricks, I like to call them, to be able to make it easier for you as the person entering the data, because from my understanding, I do know that many of you are doing dual data entry, entering into multiple systems, and I know we all understand and take that into account when we are working with you guys as the PATH folks for data entry into HMIS. So we appreciate what you all do. I just wanted to say that first and foremost. So I'm going to go ahead and get started. So apparently I haven't used a GoToMeeting in a long time because the screenshot that I have on here is actually old compared to what we're using currently. But what we are asking is for the ease and respect of everyone, and just so there's no background noise, to keep yourself muted on your phone that you're using. Until the question and answer period, we may open it up if we have time. But what we will do for sure is any questions during the webinar that you may have, as you're thinking of the question, on the right-hand side of your GoToMeeting presentation, I hope I'm explaining this right, there should be a little chat bubble, and if you click on that chat bubble, it'll allow you to send the question to everyone, and you can just send it out there, and Natalie Worley will be looking at those, and at the end when we have our Q&A session, we will start by reading off of those questions first, and then if we have time, we will continue and open it up for additional questions later. As we stated, this is a joint effort between all four continuums and the state South Carolina Coalition. Myself, I'm Kyle Jenkins. I'm the Programs Administrator with Eastern Carolina Homeless Organization. We've already met with Anthony. We also have Cecilia Rodriguez on the call. She's the HMIS Manager for the Low Country Homeless Coalition. Helen Cotton, she's the HMIS Program Coordinator of the United Way of the Midlands. Christopher, we have him as the HMIS Data Coordinator for 180 Place, and then Natalie Worley, Director of Program Planning and Evaluation and HMIS Administrator for the United Housing Connections. So the first thing that we want to talk about is PATH HMIS data requirements and definitions. So what I wanted to do is kind of go over a couple overarching ideas with how the PATH program is being implemented into our HMIS database. I'm under the assumption that many of you have been using HMIS and should have most of the what we consider basic, the basic user features identified, and you at least know how to use most of HMIS. If you have any questions about a specific way to add a client or how to do something that we don't go over today for time's sake, please get with your HMIS administrator afterwards so that way we can provide that training to you. But we're going to go over strictly just the PATH workflow today, so we're going to skip over a lot of those other things for time's sake. The first thing for PATH is this idea that there are two pots. you have two different programs in the HMIS world for PATH. One is called Supportive Services Only, and the other one is called Street Outreach. And what the PATH program means by Supportive Services Only are projects that are for the sheltered or at-risk homeless clients. So if you meet with a client in a service setting or at the shelter, then they would be entered into the Supportive Services Only program in HMIS. And we will show you what we mean by that after we go over a few of these ideas in the system. And for the Street Outreach Project, also known as, they say the street, which they mean as place not meant for human habitation. So if you've been using HMIS, what we're considering the street for PATH is also what we consider a place not meant for human habitation in HMIS. What if your PATH program focuses on both? So if you're a PATH outreach worker and you're doing data entry and you meet with both clients in the street and also in different service locations or sheltered locations, how do you determine which client goes into which program in HMIS? So if you focus on both, what we've determined is that you will use the response for residents prior to project entry. That's a field in the assessment once you open up the assessment for PATH that you will basically say, where did they stay the night before I met them? Whatever that location is what determines which pot or which project the client will go into, whether it be Supportive Services Only or Street Outreach. The responses for Street Outreach are very simple. It's just place not meant for human habitation. So if that is your option for residents prior, then you want to make sure that that client is in the Street Outreach program for PATH. If your responses are emergency shelter, which include hotel or motel paid for with emergency shelter vouchers, safe haven, they have a new term called interim housing as well. Interim housing is more the idea of having somebody in a transitional setting, but not necessarily a transitional shelter while they're waiting for their permanent housing. Sometimes that can be considered even a friend's house, or it could just be a safe place for somebody to stay until they get into the permanent housing. And then any institutional situation on the drop-down list or any other transitional, and I put permanent housing situation, but you shouldn't have any permanent housing situations. And if you do, it'd be very rare as your residence prior. So, with that being said, we have these two pots now. The only difference is instead of just putting everybody into one program like we've been doing over the past year or so, we now have to put them into those two separate programs. And you should have access to both those programs by now. If you only have access to one program, you need to contact your system administrator so that way they can give you access to the other program. Now, there are many different naming schemes that HMIS administrators use for those programs, but across the state, they should have the Supportive Services Only and the Street Outreach tagline in the name of the provider, so that way you can differentiate between the two. So, PATH admissions. PATH is not just a simple, I'm going to put them into our program and then we house them and we give them services, because we're dealing with outreach. And by the nature of outreach, as you guys know, it's not always as simple as just entering somebody into the program and then following the normal timeline of events that happens in the program. With outreach, things happen, we lose track of people. We may not contact somebody for a couple months or weeks at a time. It really depends on the situation, especially with the population that we're focusing on with the PATH. So PATH has a three-step admission process: entry, engagement, and enrollment. So they all start with the letter E, and they all kind of, sort of have similar meanings. It's like they almost made it confusing on purpose. But we're going to try to take things one at a time, and we're going to start with another E word, which is eligible. So what makes a person PATH eligible? To be PATH eligible, a person must meet two criteria. This is the most basic eligibility criteria of PATH. They must be experiencing homeless or be imminently at risk of becoming homeless. Now, that being said, the state of South Carolina PATH is focusing on literally homeless and chronically homeless individuals and families. So imminently at risk is an eligibility criteria for the PATH program, but South Carolina is focusing on literally and chronically homeless individuals and families in this area. The other eligibility criteria is the person has to have a mental illness or a co-occurring substance use disorder. So you have to be homeless or imminently at risk of becoming homeless, and you have to have a mental illness or a co-occurring substance use disorder. So when you first meet somebody, you're out there in the field and you meet a client, and they tell you they're homeless and they give you their story. That is what we consider the first contact and also the entry date into the PATH program. So the first time you ever meet with somebody out there in the field, as long as we have a reasonable expectation that the individual or family will be PATH eligible, i.e. the homeless and serious mental illness or co-occurring mental illness with substance abuse, then we will go ahead and enter that person into the HMIS database. If the person is already in the system, you can just work with their already created client ID. If not, then you will need to create a new client ID. And you also need to create a household if you're dealing with a family. And from my understanding is for households, the eligibility criteria just has to be met on the head of household for the disability part. So the entry date is the date the PATH worker first has an interaction with the individual. It's your first contact that you make, the first time you meet. A final determination for PATH eligibility is not required at entry. So at this point, we just met the person. We do not need to know for sure that the person is going to be PATH eligible to track them in our HMIS database. We just want to have a reasonable expectation. The PATH entry date will match what we call in HMIS the entry/exit date in service point. So you need to add an entry/exit for the client, and the entry date that you put in will be the date that you met that client. Step 2 of the process is engagement date. So the engagement date is defined as the date when the individual begins an interactive client relationship with the outreach worker. This could result in a client assessment or the creation of a case plan. So what that really is saying is the engagement date marks the date that the individual agrees to work with the case manager. So at first, when you first do an entry, you may just meet the person, and they may not be forthcoming. They may not be willing to work with you. The engagement date is the date that you kind of break through those barriers, and the person either gives you all of the assessment information that you need, or at least agrees to work with you and create a case plan around the PATH services that we're planning on offering them. The engagement date and the entry date can be the same date. It really just depends on the client and the different barriers that they may have. But the engagement date and the entry date can be the same, or they could be two completely different dates. As long as we don't put the date prior the entry date, we will be okay. So you can't engage with somebody before you actually meet them. So in service point, this date will be entered into the date of engagement field on the PATH assessment. And once we get through these, this next definition, I will actually go into HMIS and show you guys where those fields are. The third step is enrollment. So enrollment occurs when an individual's PATH eligibility has been determined and that the individual agrees to participate in PATH services. Michelle said that a lot of you will understand that as they are an open case for the mental health services. They're an open case. So this date must occur on or after the engagement date. So you can have a client that you meet and you create an entry into HMIS just beginning the tracking process. Then you will have the engagement date, and this is the date that you have an interactive relationship where they either answer all of your assessment questions or you start a case plan and they agree that they're going to start working with you. And then the enrollment is when they actually have been determined as path status eligible. That would mean that they have had that they have been determined as eligible. I think that a lot of clients have to have a clinical assessment to be able to be determined eligible for PATH services, and the individual does have to agree to participate in those PATH services. Once that happens, you will fill in the date that that happened under the PATH status determination field. Also, underneath of that field, you will have another yes/no question that asks when the client, if the client became enrolled in PATH. And if they were enrolled, then you would switch that to a yes. So, what if my client isn't PATH eligible? So I've been working with them for a few weeks or a month. We've engaged, we've got the full assessment, and we're working with them. And then we go to do a clinical assessment, and we find out that they're not PATH eligible. What you will need to do is you would still enter the date for PATH status determination in that field. So it's still going to be, you're still going to add the date of PATH status determination. The next thing you'll do is underneath of that, for the client became enrolled in PATH, you will switch that to a no. Choose the reason that the individual was not enrolled, which would be the next question underneath of that. It says, if no, reason not enrolled. There's only two options that I believe that are even in there. And then you will exit the individual from the PATH project in HMIS. So you can do a lot of work with somebody and then go to find out that they're not PATH eligible, and that is okay. We just need to track the reason why they were not enrolled and then exit them from the project so they don't stay in the PATH provider in HMIS for long term. So data collection challenges just with that process that we just talked about. So with that three-step approach, we know that you're going to encounter difficult to engage homeless persons, and we understand that street outreach workers may record an entry with just limited amounts of information about the client, and you're able to improve on that accuracy and completeness of the client over time. So you can update the information at entry or edit it as you continue to engage your client throughout the upcoming time that you work with them. So this is not a first time I meet with somebody, you're expected to collect all the information on the assessment in HMIS. We know that that is going to happen over time, and we expect that. But what we do know is when the data quality reports get created by our contractor, Bowman, we do know that the date of engagement field will be the date that they use that they start grading data quality. So what I mean by that is date of engagement is defined as the term of when you start a case plan or you complete the assessment for the client. So it's reasonably assumed that you should have the majority of the information in the assessment in HMIS for that client once you put the date of engagement into the system. So just be aware of that. Once that date of engagement goes in there, we are expecting that the client data is almost complete at that point, or is complete. So I'm going to jump over to the HMIS systems really quick before we get any further. There's a couple things on here that you will probably see that you don't have on your screen, and that's just because I'm a system administrator. So if you see anything that's a little unusual, just ignore that because I may have my home screen different than what yours is. So as we know, we go to the client point, and we're going to want to search for our client. We're going to use a test client today. We're going to use Helen Test. And you just want to verify their social, if you have it, their date of birth, whatever information you have, you want to use that to verify that the client that you're pulling up in HMIS is the correct client. If they're not in the system, then you will want to add new client with this information. And you can fill out the rest of this and then hit add new client with this information, and you will create a client. I'm going to go ahead and click on Helen Test. First thing you'll have is your backdate mode. With backdate mode, it is extremely important to use backdating in this database, especially if you're editing client profile information. If you're editing any information here under the client profile tab, if you click on either one of these pencils, you will want to make sure that you are backdated. The backdate that you will use is either the day before your date of entry for this client, or it could be the same day as entry for the client, as long as you make sure that your time for your backdate is 12 a.m. We don't want time to mess us up in the system, so if you use 12 a.m. as your backdate time always, you shouldn't have any problems with time. So I'm not going to go in any further than that. You do want to go ahead and make sure that you have a release of information. The whole state of South Carolina has one release of information that we're using for HMIS now. If you do not have a copy of that, or you want to make sure you have the updated version, just contact your system administrator. It is good for 1 year, so you'll want to make sure that you add that the release was granted if they signed it. The start date is the date that they signed, and then it's 1 year for the end date from that same date. Okay. So entry is the first E that we were talking about in our three-step process. To add an entry, you can do it two ways. You can do it here from the summary page by clicking on Add Entry Exit button here under the Entry Exit tab, or you can click on the actual Entry Exit tab up here at the top and then click on it here as well. Once you click on Add Entry Exit, you will have your family members up here at the top. If it's just an individual and there are no family members that you are aware of at this time with this person, just make sure that the other people in the household are not checked. If there is a household that or family that you're working with, you will want to make sure all of those household members are represented up here at the top, and that all of them are checked by clicking on either the checkbox next to the household type, or individually checking off everybody. For your provider, we talked about there being two buckets or two programs now. For Echo Region, ours is the Waccamaw Center for Mental Health PATH Street Outreach, and then the Waccamaw Center for Mental Health PATH Supportive Services only. So if our residence prior for the client was place not meant for human habitation, 100% of the time I will use the street outreach provider. If our residence prior is going to be a shelter location or a service location, then I would use supportive service only provider. So that's what we were talking about at the very beginning of the webinar. The type that we will use is always going to be PATH for either one of those providers. Now I'm going to backdate our entry right here, so that way when we go and do our interim updates, it will not cause us any problems. I'm going to update it to that 12 a.m. time I was talking about. And we're going to hit Save and Continue. So we've created our entry. To do that, we just have to have a reasonable assumption that the person that we're talking with, that we just met, is homeless or imminently at risk of becoming homeless, and either has a mental health problem or a co-occurring substance use disorder. Your assessments can vary depending on your continuum, and what I mean by that is just the order of the questions may differ, so just be aware of that. We don't all have the exact same order on our assessment currently. So that is the entry. The next part is engagement. Engagement is what we were talking about when we were saying that we have had an interactive relationship with the client where it either results in a case plan or a client assessment being completed, and they agree to start working with the worker. That field is represented on my assessment at the bottom. It's the date of engagement field. All you need to do is put a date in this field. You do have three options here that are little symbols. The first one allows you to pull up a calendar to choose the date if that's what you prefer. The blue arrow will back out anything that you put in there. So if I have a date in here and I click the blue arrow, it will disappear. And then I can also set it the current date. Just remember, when you hit set the current date and you are in an entry, the current date is now set to whatever your entry date is. So since I use November 1st, my current date for engagement is also November 1st. So I've engaged my client. I have a full assessment. So all I need to do is just put a date in here. We're going to say that I did that on the 10th. If that was the only thing that I did and I've already completed my assessment, which we will quickly go over the assessment questions in a little bit, all I would need to do is hit save, make sure that a little box appears next to my answer, and then hit save and exit. And I've updated the entry to show that I have now engaged with the client. The next E is enrollment. So enrollment is defined when we determine if they're PATH eligible and they accept those services to be in the PATH program. When that happens, I will go back into my client, click on my entry date pencil, hit save and continue, and I will go ahead and put my PATH status determination date. So this date will get filled out here. Let's say that was on the 11th. And it could also be the date of engagement. All three of these dates could be the same day. It does not have to be a couple days later. They could all be the same day, but they do not have to be the same day. So once I fill out my data PATH status determination, I then need to fill out if my client became enrolled in PATH. So remember, for PATH status determination, it could even be that they determined that they were not eligible. We still need to fill the field out, and then we would put no. But in our example, we're going to use that the client was enrolled in PATH. If he was not or she was not enrolled in PATH, then we would need to also choose the reason why they were not enrolled in PATH. The two reasons are very simple. Client was found ineligible for PATH, or client was not enrolled for other reasons. They're very generic reasons, and they may update those as the time goes on as we're doing PATH and HMIS. But currently, PATH has just used those two reasons. And then I would also hit save and make sure that my box is populated to make sure they saved correctly, and then hit save and exit. So that's your entry, engagement, and enrollment. The next part of the process, and that can be done and needs to be done throughout the entire time we work with a client, is this idea of a contact. Simply put, a contact is defined as an interaction between an outreach worker and a client that's designed to engage the client. So if you're out at the soup kitchen and you see one of your clients that you've already entered into HMIS, then that would be considered a client. Also, the first time you meet with a person out in the field, first time ever, is considered a contact. So contact really is just the idea of, did I meet with this person and speak with them in a way that engages the client to try to further our relationship with PATH. PATH outreach workers are expected to record every contact made with each client in HMIS. I understand that that is tricky, and I do understand that that can be a lot more data entry than what we're used to doing. It is a very simple process in the system, though, thank goodness. But if you do not add a contact in the outreach sub-assessment every time, then those contacts will not be counted on the PATH report. So I just want to make that very clear. If you do not add them, then you will not get credit for them on the PATH report. So using the outreach sub-assessment to add contacts. So in the system, we have the outreach sub-assessment, and I'm just going to go into the entry date because we did not add our contact yet for the first time that we met with this person. We did create the entry, and we did fill everything else out just for explanation purposes, but we did not add a contact yet. So at entry, when I first create this, to add a contact, all you need to do is click add for the outreach sub-assessment. A sub-assessment is just a simple way of saying that there is more than one answer that can be given to this question. So that's why we consider outreach, because you can add more than one contact as a sub-assessment. So I'll click Add. When you click Add, you'll have a data contact, a start date, an end date, and a location. The data contact, start date, and end date should all be the same date. So our entry date was 11/1, so we need to add our entry contact as of 11/1. And I want to make sure that it's 12 a.m. Start date should automatically be populated to the correct date, and then my end date will be 11/01/2016. The location field is just where did I meet this person during this interaction. So was I out on the street? Was I in a service setting that was non-residential? That would be your soup kitchens. That could possibly be shelters. And then service setting residential would be I'm in a permanent supportive housing location. I'm in a rapid rehousing apartment. I'm in some type of service setting, maybe a community room for a apartment complex that is designed for low income. All those are examples of residential service settings. The setting that you're in is designed to give services to people that live in a specific residential project. So we're going to say place not meant for human habitation for our first contact. Now, at this point, I can hit save, and it will add my contact in. If this was the first time I met with this person, that would be the only thing that I would have to do besides filling in any assessment information that I already have on the client from talking with them. If I'm doing data entry maybe once a week, because we understand that not everybody has time every single day, we do encourage that you get into the system as much as possible. And if you can for an hour every day or 30 minutes or 15 minutes, then it really helps so that way we don't lose track of people. But if I am doing data entry, say I haven't done it for 2 days and I met this person 2 days in a row, I am able to add another contact. The issue with this, though, is it becomes very tricky when you aren't entering in every day in real time, because you have to make sure you stay on the timeline for when you were interacting with this person. So if you do want to add multiple contacts after your entry, you can do that, but I highly suggest that you use the interim review process that Helen will go over in the next couple of slides. So this slide just goes over pretty much what I just talked about. All right, and I'm going to go ahead and pass it off to Helen to go over the general path assessment and sub-assessments for income, non-cash benefits, health insurance, and especially the disability sub-assessment.
All right. So we're not going to stay too much on the PowerPoint. So we're going to be mostly in HMIS. So as soon as I get this up and running, I'm going to switch it back over so everybody can see what we're doing. Give me 1 second. And don't forget, we encourage you that if you have questions, please don't suffer in silence. Just please make sure you're using the chat feature that we have in order for us to kind of clear up anything that you might not understand or might be a little fuzzy to you. All right, so hopefully everybody can see my screen. No, my name is not Dean Guest, but that's the account we're using, so don't fret about that. All right, so the first thing we're going to talk about is the basic entry-exit assessment. You know, I'm pretty sure y'all heard about these questions, so you're blue in the face, but we just want to make sure that you're understanding what each of them means, how important it is, because there are some tweaks that we have to make sure that we're following in order to make sure that not only the path report is running correctly, but other reports such as federal reports are pulling in correctly. Okay? All right, so I'm going to go in, we're still in Helen Test, go into her entry assessment. And like Kyle said, the order of these questions are different. So please make sure you're just paying attention to where they are. It's pretty much the same data elements that you're putting in, so just be aware of how it may differ if you're talking between continuums. Alrighty, so we're going to start off with the basic information. And like Kyle said earlier, our outreach workers, we know that y'all's main job is to develop that initial relationship with the client. So you're not going to get 100% of these data elements at the beginning. But we do expect that by the time of engagement, you do have all of these ready to go so that it pulls correctly onto any kind of data quality report. Okay? So date of birth, primary race, secondary race, ethnicity, gender. Please make sure that I've already discussed this with the mock people, but for anybody else from the other continuums, please make sure you make note that on the new assessment that the choices for gender have changed, and that if you are dealing with a client who is transgender, that we specify if it's male to female or female to male. And then the other feature has gone away, so now we're saying that it doesn't identify as male, female, or transgender. Okay. All right, so relationship to head household, county. We all have different pick lists here, so the mock people, y'all have all of the counties. So Kyle has narrowed it down for his ECHO people. Okay. Client location, make sure that you are putting in the correct location for your continuum. Don't forget, if you ever have a duh moment and you can't remember, if you hover over client location, it does give you a little cheat sheet to help you remember. So since this client is being served by ECHO, we're going to go ahead and change this to 503. And we're going to keep on working down the list. Okay? Housing status. So please make sure at this point that we are putting in what the client's current homeless status is based on the first time that you encounter them. According to past documents that we've read, this does not have to be changed as you progress and they move into housing situations. So once again, the housing status question is just for the first time that you come across them. Okay, so I'm going to say my client is homeless. All right, and then we're going to change this. So this is also changed from the assessment. It now has the conditional logic questions. So based on what you answer for the residents prior to project entry, it's either going to add more questions for you to answer or it's going to take away questions. So we said that our client was in a place not meant for habitation. We're going to say a year or longer. Approximate date started. And please remember with the approximate date started that we do understand. I know if you're like me, you're not very good with dates, and I'm pretty sure our clients cannot remember the exact date they became homeless. So as long as we're trying to get it to at least the closest month possible, but if it's been a very long time, the closest year possible. So let's say that my client doesn't quite remember, but it was November of last year. So I'm going to put 11. My computer's a little slow. Just give me just a second. We're going to say 2015. We're going to answer the question about how many times they've been homeless in the past 3 years. So we're going to say this client has been homeless twice. And the great thing is that when we take those two occurrences, we only have to go up to 12. So if you're not good with math, don't worry. You only have to go up to 12. Okay, so if you take those two occurrences and you add up the total months homeless, we're going to say our client has been homeless more than 12 months. All right, now this next section is when we're getting to our HUD verification sections and sub-assessments. This is where we do see a lot of the data quality errors, so please make sure that you're paying very close attention to this section as you're going through it, okay? All right, so the main thing I tell all of the people I train is you want to make sure you get rid of those ugly red triangles. You want them to go away. You want the pretty green boxes with the check marks. Okay. All right. So we're going to talk about income from any source. Now, please remember this does not include non-cash benefits such as SNAP benefits. Okay. So this is like SSI, SSDI, earned income, things like that, okay? So we're going to say, yes, our client is receiving income. I'm going to click on HUD verification. Okay. And let's say right now that my client is earning earned income. Okay, so I click yes. And what we do want to make sure of, everybody, is that those dots that we see in the sub-assessment, that all of the dots are either in the yes or the no column. If just one of them is out of place, it will show a data quality error on your data quality report. So let's please make sure we're paying close attention to those. As stated before in your initial training, don't worry about clicking on every single button. The easiest way is to click no. It fills in all the dots for no, and then you can move and click the ones that are answered yes. Okay. All right, so we're going to talk about Helen's earned income. So we're going to say right now her monthly earned income is about $400. Okay. If you want to add a note about like where she's working or anything like that, you can add it to this section. The start date, we want to make sure that we do understand, once again, that dates are kind of hard for our clients to keep track of, and that's okay. So we want to make sure that we're trying to get it to the closest day possible that they started receiving that amount of income. Because what we're looking at, especially like with system performance measures and other reports, is that they want to see, is the client making progress when they're with you? Are you helping them to increase their income, their non-cash benefits, and things like that? So we're going to ask Helen, we're going to ask her some more probing questions and try to figure out the date that she started receiving the $400. So after talking with her, we figured out it was sometime in May 2016. So I'm going to hit save. Okay. So I'm going to double check to make sure all of my dots are in the yes and the no columns. And then I'm going to exit. Okay. All right. Then we make sure you put the total monthly income of what the client is receiving. Okay, so we're going to say 300. All right, the next one, non-cash benefits. So once again, this does include SNAP, TANF, anything like that. And a lot of times when we have people putting in data to HMIS, they do forget that if somebody is getting like temporary rental assistance or housing vouchers, that is a type of non-cash benefit. So make sure that as we're going into the interim update section, that you're paying close attention to that, because once again, we want y'all to get credit for helping these clients receive these types of benefits. So we need to add those into the section. Everybody hear me?
Yes.
Yeah.
Okay.
2 seconds, but you're back.
I don't know what happened. Sorry.
Yes.
All right. All right. So we're going to say that right now our client does not have non-cash benefits. So I'm going to click on HUD verification. Okay. So I see that there's a couple out of place. So I'm going to go ahead and move these over to the no column. But I may see an old entry from maybe another organization that back in the day that she was receiving SNAP benefits. So what I want to do is I want to come in here and click on the pencil, and I want to make sure that we go ahead and close this out properly. Because if we don't, this is going to cause a lot of data quality errors and some system errors later on down the road, okay? But we just encourage you that because this section is quite clunky, we just ask that if you're not sure, once again, don't suffer in silence. Give us a call. Let us help you. We can shadow you, and we can figure out what's happening, okay? So we're going to say that after talking with Helen, that we've determined that she was receiving food stamps for a portion of the time, but she lost it for some reason. So we're going to say that after talking with her, figuring out the date, that it was about February of 2016. All right, so once again, it'll go to incomplete. Just be careful that if it doesn't go to incomplete, that may mean that there are some other entries for the sub-assessment that are open. Just call your system administrator and let us look through like previous records to figure out what's going on and why that dot is not going back to incomplete, because it can be a little complete and we don't want y'all to have to stress out over that, okay? All right, so she's not receiving food stamps anymore, so I'm going to click no, and I'm going to save and exit, okay? There's my beautiful green box, so I know I'm good to go. All right, the next one is
Helen?
Yes?
I'm sorry, I just wanted to back you up on one thing with the sub-assessments. So you mentioned with the income and the non-cash, and it's the same for any of the ones that we're doing that you're going over. If you do not know even the approximate date of when that benefit or that income started, that the last resort would be to use the entry date into the program for PASS as the start date for that benefit or income. So if they really truly don't know and they don't even want to give you an estimated month or anything, you could always use the entry date for the program that you're currently entering them into as the third option for that. I just wanted to iterate that.
Thanks, Kyle. All right, the next one is our health insurance. We're going to say, yes, our client is receiving health insurance. Go into HUD verification. Okay, so far everything's marked no. But let's say that we know that they are through Medicaid. They have Medicaid. So we're going to click yes. And usually sometimes with the non-cash benefit and the insurance question, it's a little clunky because sometimes you have to, instead of clicking on the dot, you have to click on the pencil. It just takes a little extra step. All right, so we're going to say no, covered start date. So we're going to say that as of we'll take for that example that Kyle gave us. As of, we know that they aren't sure of the date, so we're just going to go ahead and put the start date for when they came into the program. Okay. So hit save. It's recorded, and I'm going to hit exit. Okay. All right. Disabling conditions. So this one is, this is the one we're mostly concerned about with y'all because you're really getting down to the nitty-gritty of what disabling conditions the client is having and maybe why it's causing their homelessness. I ask this a lot when I'm training people for the first time, and I ask them, do you have, what do you consider as a disability? And pretty much 99.9% of the time, not everybody can name off all the disabilities that HUD and PASS seem as a disability. So sometimes it's a good idea with this one to go into your HUD verification first, and we can look to see, okay, and we can start naming off the different disabilities and kind of giving them examples for like chronic health conditions. That would include like diabetes and emphysema and things like that. And just going through that list, sometimes that helps our clients a little bit more to figure out what's going on, okay? So let's say that a previous provider has notified the system that they are receiving mental health, that they have mental health issues. So what we're going to do is we're going to click on the pencil. Okay. All right. So this little sub-assessment within a sub-assessment pops up. And so please remember that not only are we answering the questions of, is it going to impair their ability to live independently? Is there documentation? That as PASS providers, that y'all are also making sure that we answer the PASS specific questions. So how is it confirmed? If it's mental health, how is it confirmed? So on and so forth. With this one, please make sure, I need everybody to listen carefully, okay? So if a client comes to you and you recognize and you're doing their assessment and they're not receiving services as of that time, what we're going to do is we're going to answer this question no. Okay, so I'm going to answer it no for right now. Okay. I can make a note about my disability because we're going to come back to this once we do the interims, because there's something special that we have to do to now show the computer that they are receiving services through PATH or whomever we refer them to. Okay, so make a note about that. We're going to come back to that. Make a star, highlight it, smiley face next to it, because that's the one that we need to make sure we're doing. Okay, so we're going to hit save. And then we're going to hit exit. All right. And we have the questions that Kyle went over with engagement, past status, and then we have our SOAR benefit. Okay? So we're going to say right now that the client does not have connection with SOAR, and then we're going to save and exit. Okay? Now, we're going to move away from entry, and we're going to talk about interim. So I'm going to come up here, and I'm going to get rid of a back date. We're going to pretend like it's today, and we're working with this client. All right. So once again, we saw this client back on November 1st. But now it's October 8th, and so we need to update that information. Maybe we've been working with them for a month, and we've got them a lot of, maybe increase their earned income, or we help them receive services. So we want to make sure that we are, as soon as something like that, especially with those big HUD verifications, as soon as something changes with that, we definitely want to make sure we're coming in and we're answering and updating that client information. Because if we wait to the exit date, we're not going to know. And, once again, not good with dates. Y'all have a lot of stuff on your caseload. We don't want y'all to forget something and not get credit for the great work that you're doing with these clients. Okay? So it's now, December 8th. We're going to click on the interim. And if for some reason that you don't see this section, please contact your system administrator. To make sure tell them, hey, I don't have the interim button, look at mine and let's figure out what's happening, because that has happened before. Okay? So we're going to click on interim review, and we're going to add an interim review. Okay? Now, some agencies say, hey, you need to do interim update every 30 days. Our permanent supported housing folks, they do it annually. But if it's just a client coming to you really excited because they've increased their earned income, they're going to raise their job, we can just put it's a regular update. Okay? So, like Kyle said, we're going to change the time just to make sure nothing interferes with time. And we're going to hit save and continue. And usually with our update assessments, they are more condensed down, because by that time, you kind of know the basic demographic information for the client, and there's no need for us to, sound like a broken record and repeat all that information on you, okay? All right, so let's get down to the HUD verification portions, and let's update this for our client, because y'all are great outreach workers and great PATH folks, and y'all have helped this client progress into their treatments and become more self-sufficient. So we're going to come in here and click HUD verification. All right, we're going to say earned income. Now, all of the steps that I'm going over with you in the PowerPoint, if you click on interim update, it will take you to a document that you can have next to your desk or whatever that will show you screenshots of everything that we're doing here, that you can walk through it by yourself as you kind of check up on yourself as you're doing interim updates, okay? Alrighty, so we have income. So we're going to say, so she came to us, she said that she got a raise at the first of the month. So what we want to make sure that we're doing is we want to exit this amount of money out, okay? We don't want to just come up here and change the amount of money, because that it's not going to give y'all credit, and it also creates a lot of system errors. This is something that we especially saw with our system performance measures that we had to turn in this year, that this section of increasing income, like how many clients increased income, was not good at all. So, my university people, y'all have already had training on this, but for everybody else, please make sure that you're being very careful of this section and not just changing the amount of money. You're actually closing it out, okay? So we're going to say that Helen, she got an increase on the 1st of the month, okay? So we're going to end this, let's say 12/01/2016, okay? Once I hit save, it's going to throw it back over here to incomplete. Once again, if it doesn't shoot it back over to incomplete, please call your system administrator and kind of tell them what's going on, and let's look, because we can see all the other records, and we don't want y'all to kind of go in and, you know, kind of accidentally exit something that we need to actually keep, and it wasn't just exited out correctly, okay? So we're going to come back in, and we're going to say, yes, she's still earning earned income, but now we're going to increase it to $700, okay? And the increase in income came on the 2nd, and we're going to save, okay? So what that does is closes out the old amount, and it opens up the new amount. And once again, if it's during the time that y'all are serving this client, y'all get credit, so to speak, for helping that client increase their income. Okay. So I'm going to exit out of here. Don't forget to make sure that if it hasn't changed already, that you go in and you change the total monthly income amount. All right, non-cash benefits. We're going to come into HUD verification. We see that right here, we need to make sure that, once again, that if they are receiving some type of rental assistance at this point in time, we do put that into the system, or temporary rental assistance, okay? All right.
Not a mistake.
Huh?
We should have disabilities on there.
Should have disabilities on. Okay. So since disabilities is not on here, we're going to pretend, use your imagination. So like we said before with our client who has disabilities. So at the point in time that she came into the PATH program, she was not receiving services for her mental health issues, okay? So what we're going to do is, let's say, Terrence, I'm going to pick on you, okay? So let's say that Terrence is working with Helen, and he has gotten her connected with services and treatment for mental health. So what Terrence is going to do is he's actually going to go into the sub-assessment, and he's going to actually put an end date to that disability, okay? He's going to open up another mental health street, or another, mental health section within the sub-assessment. And then what he's going to change on that is he's going to answer all the questions like he should, the past specific questions and all the other questions. But the only difference is that this time, he is actually going to put yes, receiving services, and then put the date that she started receiving those services. So that way we can recognize that when a client comes in, yes, we may have recognized that they have mental health issues, but we're also, once we close out showing that they weren't receiving services and opening up the new mental health assessment and is showing they're receiving services, once again, it give you credit for helping them receive those services. Okay? like I said, there is if you click on where it says interim update, there is a walkthrough, a step-by-step screenshot guide to help you through this process. But like we said before, please do not suffer in silence if you're not understanding or something looks weird to you. You know, this is our job, this is why we're here, and we want to be able to help you in any which way we can. And then once you come back to the screen, this little circle right here with the number lets you know how many times the client record has been updated. Okay. All right, Kyle, I'm going to turn it over to you, okay?
Okay, thank you. And we got a bunch of crackling. I don't know who it's coming from. I think it might be coming from Anthony. If we could mute him.
I have been muted, but
I guess
go ahead and do it on the computer if you need to.
It must just be the connection then.
Here, I'm going to mute myself, see if that's the problem. Hold on one second.
Okay. Thank you, Helen. So as Helen was talking about with the income, non-cash, health insurance, and disability sub-assessments, you want to use the HUD verification links to complete those HUD assessments. So you just click on that HUD verification symbol. Make sure all responses to the sub-assessment have been filled in as either yes or no. So on that list that she was showing, you want to make sure they all have a yes or a no. And then the income and disability sub-assessments will ask for additional information if yes is selected as a response. I just wanted to reiterate the disability sub-assessment. When you do select yes for a disability, you want to make sure that you answer the if yes expected to be of long, continued, and indefinite duration and substantially impairs the ability to live independently. If you are selecting this as a disability for the client in a past program, that should be yes. And then if yes, the documentation of the disability and severity will be on file. If you don't have it, you'll select no. If you do have it, you'll select yes. Then the 1, 2, and 3. So the first one is if the disability type is mental health, alcohol abuse, or both alcohol and drug abuse. So if you have selected the disability type up here at the top, for either one of those 4 disabilities, then you will want to answer number 1. If the disability type is mental health, as it is with this one, you also additionally want to answer number 2, which is it a serious mental illness, SMI, and how confirmed is it? And then where Helen was talking about with the currently receiving services or treatment, this is actually for all services, for all disability types. You do want to answer if they're currently receiving services or treatment. And if it's no, then we'll select no. If it's yes, we'll select yes. And then we need to update that in our interim reviews as that changes while we're working with the client. All right, so the next thing we're going to go over is service transactions and referrals. So the client has been entered into the HMIS database. We have engaged the client, which means we have a full assessment completed and they're actively working with a case manager in PATH. And we've also enrolled them in the PATH program. They've been determined eligible and we have enrolled them and they're working with PATH-funded services. Until we get to that point, until we get to the engagement point, we don't want to worry about adding service transactions or referrals into the system. If you do, just be aware that they are not being tracked by the PATH federal partners until the client is engaged, until they have the date of engagement filled out on the assessment. None of the service transactions or referrals will be counted. So we are suggesting just to add contacts in the assessments, either through the interim reviews, until you engage the client. Once you engage and hopefully enroll them into PATH, that's when you'll want to start adding service transactions and referrals into the system. You can still add those services and referrals. Just be aware they will not be counted towards your final service count in the PATH report in the end of the year. So Some users in the state of South Carolina will need to use the enter data as mode. I know in the Echo region and I think in the Low Country region, you will both need to use enter data as mode to enter services and referrals. And this has to do with a historical issue of where this provider was set up in our system. And since they've made these changes over the past 2 years, instead of moving them, we just created a workaround. So if you're entering services or referrals for a client, you must use enter data as mode to be able to enter those services. And that's identified here in the picture. You can see where that is. And in the system, it's up here at the very top right-hand side. So you won't have this shadow part, but you will have enter data as mode. You will click on that enter data as mode, and you will select, you will have from your provider search results, you should have your different past projects. So if this person's been entered into the street outreach project or program, we will enter our services under the street outreach or program as well, and our referrals. But if they were entered into the supportive services only program, we will enter in their service and referrals under that program. So just want to make sure you choose the right one. So we're going to use outreach since that's what our current example is. When that happens, you will be reset back to your home page. So just be aware of that. Always check your top right-hand corner of the screen to make sure that it says the correct provider there. If it's not the correct one, you can click on it, and it will open your box back up to select another provider once you click on Enter Data As, and you can change it. Go to your client point, look up your client. Hopefully by now you got a client ID number, and you can just type it in, and it'll pull them right up. Okay. So now we're going to go to our service transaction tab here at the top. You got two main tabs in HMIS Client Information, which has all these sub-tabs that we work with on a daily basis. And then the Service Transaction tab is another main tab. When you open that up, it takes you to the Service Transaction Dashboard. Now you can use these dashboard module items to select and add services and referrals. I think it's a little clunky. I always suggest my users to click on View Entire Service History so you can see the other services that have been provided that are visible to you, and then you can add your services and referrals from there. But one thing I do want to make sure that everyone is clear on is we do not have to add needs. So in our system is designed to be able to add a need separate from a service that we provided. But with our HMIS and the way that we're currently operating the system, we've already provided that service to the client, and now we're just tracking it, and we're just putting it in the system to record it. So when you add a service or multiple services, the system automatically will create the need for you. So you do not need to create a need and then create a service. You can just create the service, and the system will take care of the rest for you. So like I said, I like clicking on View Entire Service History. You will see all the different services and referrals and shelter stays that a client has had, and it breaks it out by the need and then the service like we were just talking about. And what you'll want to do is, depending on if you're doing a service or referral, we'll do services first. You'll click on the Services tab, and you can hit Add One Service, or you can add multiple services. I'm going to do Add Multiple Services. When you do add multiple services, you want to make sure that your service provider here at the top says the correct program, that does not say the supportive services if this person was homeless when you initially contacted them. If this says I'm the wrong provider here, it means that your Enter Data As mode was not put in correctly. So this service provider should match what your Enter Data As provider is at the moment. When you're going through multiple services, this screen can look different depending on how the HMIS administrator set it up. I'm pretty confident that we all have ours set up this exact same way. The top bar you have here is the number of total services that you want to provide. I suggest you just leave this blank. Don't worry about the gray bar at all. Then you have your number of services. So this is the number of services that you want to provide for the service type that you were selecting. So if you wanted to enter in 2 services of case management, then you would enter a 2 here. But if you only want to enter in one of each service, then your number of services for each service will be a 1. I know that gets a little confusing for a lot of my users. Your start date and end date, you want to make sure they match up. So I'm going to use, let's see, our engagement date I think was around the 10th. If not, then I apologize. So we're just going to use a start date of 11/11/2016 for this. And I'm going to make sure that our time says 12 a.m. Your system admin should have it set up so where your end date will automatically mirror your start date so you don't have to edit all these fields. Under your service type, you should have an approved list from our contractor, Bowman, of the different services that they are suggesting for PATH-funded programs. So these services are all ones that are approved by Bowman, which is nice because Bowman provides us with a very handy cheat sheet that we're going to send to you guys in an email if you don't already have it, that allows you to know which service type to select for which PATH-funded service provider that you are going to select lower down. I do not have that in front of me at the moment, so I'm going to just use an example, and if I'm not correct, just bear with me. So I'm going to do a service of case care management. Service staff, you may or may not have people in here. It really just depends. It is not a requirement of PATH to select someone for who provided that, the staff member that provided that service. Type of PATH-funded service provided. So this is the important field in the services. If you do not put anything in this field, your service will not be counted on the PATH report. So to get credit for the service, you have to put the service type and select the type of PATH-funded service. I get that it's kind of redundant, but PATH wanted to have a certain drop-down list that they use for their reports. So that way when we put the information into their, I think it's called the PDX, all the information correlates to the same because we're using 2 different databases. So I understand why they did it. So you would want to select which PATH-funded service you are providing. And again, like I said, we will provide you with a crossover, like a crosswalk. So that way you can say, okay, my service type is case care management. I know I was providing case management, so my PATH-funded service is obviously case management. But some of them are a little trickier and can mean multiple things. So you would want to make sure that you did case management. You may or may not have the service call field. It's not required. And then your need information is required. You always want to set your need status as closed, and if you provided this service, then you want to put fully met. So we're going to add another service. We're going to say we did 2 services with this client. So I'm going to hit add another. Be careful not to hit remove or remove all because that will remove everything we just did. So again, number of services 1. I'm going to use 11/20 for this date. And I'm going to select it to 12 a.m. My service type for this time, I'm going to do street outreach programs. My type of PATH-funded service, I'm going to do re-engagement. So re-engagement is a new service that's been added to the type of PATH-funded services provided field. And what used to be that they had a option that said outreach, which is very confusing. Outreach can mean multiple things, apparently, in the PATH program. So re-engagement has now been redefined. And what re-engagement would be is if somebody has been re-engaged with PATH services after not having them in a while. There is a specific definition for re-engagement that is in the SAMHSA guide, and we will also send that out with a nice little cheat sheet that tells you the definition of each PATH-funded service and each definition of PATH-funded referrals. So that way they can sit there at your computer while you're doing your data entry and we make sure that we're classifying these correctly. So I just wanted to point out re-engagement is a new field. It used to be considered outreach, but with outreach that could mean other things as well. So they have defined re-engagement as a separate type of PATH-funded service. My need status again will be closed, and I'm going to put my outcome as fully met. And at this point, I'm done adding my services for this particular client. So I'm going to hit save and exit. And so I've created those 2 services. I'm going to delete this one out because that one wasn't done correctly, but that was an old one lingering there. So these are the 2 that we just created. So they've been documented. They are in the system. The referrals is a little more cumbersome. So to add a referral, you want to click on your referrals tab and hit add referrals button. When you're adding services and referrals, you do only want to add these services to your head of household if you have a family member or family. So the first thing you'll want to do is you'll want to select the service code that you're referring for. So we will pick something off of this list. It should mirror the services list. And we need to select which one we're referring for. So we're going to do, let's do mental health care facilities. And I'm going to hit add term. So you know you selected it because it's blue. And when you hit add term, that blue will disappear. So that's how you know you've selected it. Another way you can tell if you got distracted and you didn't really know if you clicked it or not is you can scroll to the very bottom. And under selected needs, you will see that service that you just selected. You are able to select up to 5 services. I suggest doing no more than 3 because it can get very confusing at the end for which provider you're referring which service to. So to keep it simple and streamlined, I don't suggest doing any more than 2 or 3. So I'll select 2 so you can see what that looks like when we get to the end. If your service is not listed on the service code quick list, for referrals, you are able to go to the service code quick lookup and you can search for terms. Be aware that there are probably hundreds of thousands of terms in here. And our 211 system, that is the phone call-in for the state of South Carolina, manages our heirs taxonomy code for our service code. And not all of them are able to be selected. So if you see them grayed out, that means that they are not able to be selected, and when you select them, they'll say they're inactive and cannot be assigned. But there should be for every service out there, there should be either a more broad or more specific service if the one that you thought fit initially is grayed out. So just make sure you're looking at all of them, and don't get too carried away here. If you're getting a bunch of referrals for something that's not on your service code quick list, let your HMIS administrator know, and they may possibly be able to add it to your list so you're not having to do the service code lookup every single time. So then we want to select our provider. Now, we all do this a little bit differently, so I just wanted to be very clear about that. The way that we're doing it in the ECHO region is we are actually just using what we call a placeholder provider to send all of our referrals. So we're just using the generic referral provider from the drop-down list for all of our referrals. There may be other providers on your provider quick list for referrals, and if they are, if you're tracking your referrals and you want to know exactly which provider you sent those referrals, then you're more than welcome to send them to the appropriate provider that you are actually sending the referral to in real life. If that agency is not on your provider quick list, you also can search it. What I suggest is if you are going to have to search for a provider from the search criteria, that you do that first. The reason why is there are a ton of service codes, and if that exact service code has not been coded to that particular provider, it will not show up on your search results. So to make it so that way you're not accidentally filtering out a provider because you've already selected a service code, just make sure that you do that first. Select your provider first and then your service needs. And if you're doing it a lot, again, contact your HMIS system administrator so that way they can add it to your quick list. So that way you don't have to do that every time. So once you pick the correct provider, you'll hit Add Provider. Or if you've searched your provider, you would click the green plus. I'm going to throw one in there just to show 2 different providers being selected. So my selected providers now shows me which providers I've selected out of the that I want to make my referrals to. Under the referral data screen area, there's a couple different things. We do not have any control of how this looks. If we did, I would move these questions out of here, but we don't have that option at the moment. So for right now, you want to look for these 2 questions, the type of path referral and the if any type of path referral made, select outcome. So those are the 2 that you guys have to do to be able to get credit for referrals. So same thing for the service transactions. You have to do the type of path funded service. You have to select the type of path referral to get credit. If not, you will not get credit for it in the path annual report. So I'm going to select my referral type. Again, we have the crosswalk cheat sheet that we'll be sending out to everybody. That being said, you do want to make sure that when you do multiple referrals, that they fall under the same path type. For PATH, it's the only program that we have that we have to worry about that with. But because you can only select one type of PATH referral, if you are going to do multiple referrals, as we are in this example, you want to make sure they both fall under the same PATH type. Unfortunately, the 2 examples I selected are not the 2 PATH same types, but I'm just going to put it under community mental health for both of these since one of them is mental health. So after you select the type of path referral, you do want to select the type of outcome. PATH does expect that you guys are tracking your referrals and you are updating the system on the outcome of that referral. So if you do not currently know if that person is going to be, the referral is going to be attained or not attained, then you can leave this blank. But I do suggest that you keep a track of all the different ones that you have not selected the outcome for, either on a spreadsheet or something like that. Your system admin may even be able to create a little report for you, if possible, to be able to keep track of the ones that you have not selected an outcome for. But you do have to select the outcome, and it's simple: attained, not attained, or unknown. So you don't want to have a ton of unknowns, but you are going to have some. Sometimes we just won't know. So we're going to say attained for this one. So for our referrals, after we do all that, we then need to tell the HMIS system, since we selected 2 different services and 2 different providers, we need to select which service goes with which provider. This is where it gets tricky if you have more than 2 or 3 of them. And since we're talking about PATH, and I had mentioned about the type of PATH referral, only being able to select one, it may just be a good idea to do one at a time, so that way you don't mess yourself up. But if you do select 2, you can always check off the boxes for which service goes with which provider. Pretty simple when you only have 1 or 2 of them. Just check the box for the service that goes with the correct provider. Then for your needs at the bottom, just like with services, we need to identify that the need status is closed for both of our services. And then for the outcome, it really, what we just normally suggest is that you put fully met. And the reason why we say that there is because you are tracking for past the outcome up here. And then just hit save all. So we just actually created 2 referrals for this client. Okay, I'm going to jump back into the PowerPoint real quick. So don't forget about the enter data as mode before you do your service and referral, especially if you're in the ECHO region or the low country region. Services and referrals should not be documented as PATH funded until a client has been enrolled in the PATH program. That's what we were talking about before. So until the field date of PATH status determination is entered, it is suggested to only add contact to the outreach sub-assessment, as any services or referrals before the enrollment into the program are not counted on the PATH report. And this is just going through what I was talking about, highlighting the type of PATH-funded service provided for services. Same thing for the referrals. Okay, so we've had the client in our system for a while. We've been working with them. We've been doing updates for interim reviews. We've filled out all of their information at the entry. We've been adding services, and we've been adding our contacts to our outreach sub-assessment every time we go into the system and meet that client. Every time you go into that system, you want to go ahead and add a contact for them. So now we're at the time of discharging the client and exiting HMIS. So how do you know when to exit a client from the PATH program in HMIS? There's a lot of leadway with this, but we have narrowed it down to 3 general ideas of how you know when you are exiting somebody from the PATH program in HMIS. The first one is when a client successfully completes the program, which means they successfully are housed and connected to services. That could be enrolled in permanent supportive housing or rapid rehousing programs or any other housing programs that may have services available to them as well. Or when a client is housed and in a more stable condition, for example, the clinical staff makes a decision to discharge the client. This would be if they were in their own rental situation or in a rental situation that did not have supportive services that go along with it. Then the PATH program can provide those supportive services, and I think Michelle mentioned to approximately up to 6 months after they've been housed. And what will happen is the clinical staff, we don't want to tell you as HMIS administrators when that will happen because it will vary and you're the experts. So you guys as the staff will need to make the decision on when to discharge the client from the program at that point. The third way that you'll be discharging clients is if a client is unable to be found and has not been contacted. And we're just using a guideline of approximately 90 days or 3 months. So if you've worked with somebody, whether you've engaged them or enrolled them or you've just entered them into the system, we need to make sure that those clients in our caseload, if they haven't been contacted in about 90 days or 3 months, that we just go ahead and exit them out of the program. Because we're, at that point in time, things could change, and we may never see them again. Maybe they've moved, or maybe they've resolved their own homeless issues, or maybe they're in another program. So just be aware that if you don't see a client, you do need to exit the client after approximately 90 days. If you re-engage with that client again, or excuse me, if you find that client again later on, let's say a year down the road, you see them again, then you will just need to create a new entry into the PATH program. We don't want to open up the old entry. That one's old news once we exit it, unless it's like 1 day or 2 days afterwards that you see the client again. It's old news. We're going to create a new entry into the PATH program and continue from there, from the beginning of that process. Good thing about that is if you create a new entry and it hasn't been that long, a lot of your answers will pre-populate into that assessment for your new PATH program entry, and you're just updating from there. So if it's not changed, then you can leave it the same, and if it has changed, you'll make sure that you need to update the answer to the appropriate response for that moment. When you exit a client, you will click on the pencil next to the blank exit date in the HMIS system. So when we're in our client information, under our summary page, you can see the pencil next to the blank exit date. Or if you're in the entry exit tab, because maybe you've done an interim or you want to see your interims first, you can click on the same pencil next to the blank exit date. When you click on that, you're editing your exit information. I like to think of each one of these as snapshots in time. So your entry is a snapshot in time, your interims are snapshots in time, and your exits are snapshots in time. So we want to make sure that we put the correct exit date, and then we also want to fill out our reasons for leaving. Pick the best reason for leaving that fits the situation that you have. If they have disappeared, then you would want to identify that. If they completed the program, that's probably because they're now in a housing situation and they're connected with services. So we're going to do completed program. Your destination is also required. So this is the destination. So this is where they are sleeping at the night that you exit them. So if you exit them and they're in a rental by client with no ongoing housing subsidy, they're in their own rental situation, that's what you would select as your destination. If they're in a permanent supportive housing project, then you would put permanent housing for formerly homeless persons. Let's do that one. You can put notes, none of those are required. And again, I almost forgot myself, do the 12 a.m. so your times don't mess you up with anything. Save and exit. Once you save and exit, you will then have your final exit assessment that you will need to complete. And this is, like I was saying, snapshots in time. So this exit assessment is now documenting the last contact that I ever had with this person. Where was their information at? So you will want to add another contact, your final contact for this client when they exit. So we're going to do 12-8, and then your location that you met them. So we're going to say maybe it was a service setting, non-resident. Let's do residential. Let's just say they were in their own home. So we'll hit save. By this time, when you exit the client, you should have a date of engagement in here, and you should also have a path status determination, whether it is that they became enrolled or did not become enrolled. Once you're exiting a client, these two fields should be completed. Connection with SOAR. So if they were now connected with SOAR since you've been working with them, let's just say that was the last thing you did was connect them with SOAR, then you could update that to yes at exit. Or you can also update the connection to SOARs during your interim updates, which was what we suggest, so that way you show your progress as you're making the progress in real life. Finally, we're going to confirm any of our income amounts. So if they haven't changed, we can leave it the same. Make sure your total monthly income adds up to however much the current income they have. Be very careful, though, when you do look at the exit, you'll see all the historical incomes that the person has made. So if you have an end date on it and the end date is before the exit date, you will not count that in your total monthly income. Do the same thing for health insurance, disabilities, and non-cash benefits. And then we're going to hit save and exit. Once that's been completed, you've exited the client from HMIS. It should mean that they are no longer an open case for you as a path outreach worker, and they are not on your caseload. So that's kind of the whole timeline of events for the PATH program and the workflow on how you will go through those. The next thing that I wanted to go over is data correction. But before I do that, I just want to quickly review. We're getting ready to be finished here. We're got about 15 minutes. I thank you all for sticking with us. I know it's been a long webinar. It's a lot of information. I did want to just go over and review real quick. So the first time that you meet with a client, you're going to decide if the person is going to be put into the street outreach program or the supportive services only program. You should have two options. That will be based upon the resident's prior answer that you put into their entry assessment. The only one that you use for street outreach is place not meant for human habitation. For supportive services only, you could use a multitude of different options. As long as it's not place not meant for human habitation, then they will go in the supportive services only provider or program in the system. Once you've determined that, you'll create the entry and you'll add them to the appropriate one that we just decided. And then you'll need to fill out all the entry assessment information that you possibly have at the moment. And that would be this information here at entry. And you'll know you're at the entry assessment because it will say entry assessment here on the left-hand side. That's how you know which assessment you're currently looking at. So just be aware of that. So you'll answer whatever you possibly can here. And then if that's all you can do and you weren't able to engage the client at that first contact, then just make sure you added your first initial contact, which will be the same date as the entry. And then you close them out, you save it and you close them out, and then the next time you engage or you contact that person again, then you will go back into this assessment and you will update any of the information that you have then received. Make sure that you do completely fill out the entry assessment with all this information before we put the date of engagement in there. Like I said, that's when your data quality scores will be in effect, is once this date gets put in. As much as possible. There may be some information you don't ever get, but The idea is to collect 100% if we can. All right, so once we engage the client, which is the interactive client relationship that results in a case plan, you want to put the date into there. And then you also want to make sure that you do your data path status determination once that is decided as well. Whether it be yes or no, you'll select what the option is for if they became enrolled, and if they aren't, you want to select the reason. Okay? As you're doing that, make sure that you add contacts in for the appropriate dates. Every time you go into the system on this client and you're adding stuff, you want to make sure you're adding the contacts. Out there in the real world, if you meet with the person, you add the contact. I keep hammering on that because it's so important. We don't want our contact numbers to go low just because of the system that we're using. So as information gets updated as we're working with the client, so we've figured out our first initial entry assessment, we've completed it. Now we're just updating information like income, disabilities, non-cash, and health insurance information, and the connection with SOAR. We'll do that by adding the interims, and we'll add our interim views as updates, and we'll complete those assessments as Helen talked about. We'll also be adding contacts as we do that, so don't forget the contact. Service transactions, we'll be adding services and referrals that we provide to this client as we work with them as well. Anytime we do a service or a referral, don't forget to add the contact as well. So the idea is you don't want to add more than one contact for any given day, but if you see somebody 2 days in a row, you do want to add two different contacts for those 2 different dates. So we don't want a bunch of contacts all for the same day. It's really just based upon day. But we do want to track it for each day. Then once we're done with that, we're going to do our exit, and we're going to exit them from the program once they're either connected to housing and services through another program, or they're in their own apartment and we're providing services, and now the clinical staff have deemed them appropriate to be discharged from the program, or we've lost track of them and haven't spoke or contacted them in 90 days. We will do the exit date, and we'll select our reason for leaving and the destination, update any assessment questions, and then we're done for that particular client in HMIS. Data correction. So as the reports, currently at this time, there is no path approved data quality report. I have heard from our contractor Bowman that they will be coming out with a path data quality report. So bear with us through this kind of period of time where we don't have a specific path data quality report, but we will be using a combination of different reports to check for data quality in the PATH program. Some of you probably know them as the 252 report or the 631 reports. There's a combination of reports that the system administrator can use or that you can use to check for your data quality. When correcting data errors or filling in any missing data known as nulls on the 252 report, it's important to understand at which point in time the error is being found. So with some reports, it'll tell you the error is found at entry or exit, or give you an interim date that the error has been found at. It's highly important that you know which date or which entry or exit point that the error is found, so you don't accidentally update information for a different point in time that was already correct. HMIS tracks changes over time, and a data element can be okay at entry, but then have an error in the interim update or an exit. So be aware of which snapshot in time. That's kind of just a reiteration of what I said, but just be aware, especially with those sub-assessments of income and disabilities and health insurance and non-cash benefits, that it can be okay at entry, and then because of an update that did not happen the correct way, there can be an error in the interim review or at exit as well. Further training to read data quality reports can be given by your HMIS administrator. We don't want to go into too much detail, but we did want to definitely reference it in this webinar. Data correction is a part of the data HMIS process. No one's expected to get it 100% correct 100% of the time. So I just wanted to make a nod to data correction and you know, talk about the importance of how it will be, how important it will be for your PATH team that we correct data errors. And all of our HMIS administrators are very, very good at making sure that we're keeping up with data correction errors and training on how to do that. that being said, we wanted to do our little Q&A. So we're going to pass it off to Natalie Worley. We may just go a few minutes over, but we're probably going to end pretty much right on time. So Natalie, it looks like we only have about 4 questions in the chat box. So
I am only seeing 1 question in the chat box from Vaughn. So.
Actually, all of mine were just, can you make me the presenter? I think people were accidentally sending that. So I only see 1 as well.
So, and I think maybe we'll hand it over to Helen, since she talked kind of in depth about how to do the interims. And Vaughn's question was, does entering a service for a client negate the need to do interim updates? Is Helen talking to herself again? I'll be muted.
No, I was thinking Kyle was going to take that over.
Oh, okay. Kyle?
So the short answer is no. PATH expects to track the services as well as interim updates. The main difference between tracking services and updates, though, is an interim is designed to only be done when you're adding a new contact in the outreach sub-assessment or making a change to any of the information like income, non-cash benefits, health insurance, or the disabilities or any of the questions in the disability sub-assessment. So a good example of that would be I provided case management service for that person on the 12th of November. When I get back to my computer, I'm going to pull up that client. I'm going to go and I'm going to add an interim review for the 12th of November. I'm going to add my contact. If while I was with that person, they let me know they had changed their income, then I'm going to also end my old income that I had if it was a yes. And if it was a no, I'm still going to end it because I need to show that they didn't have income at entry. And then I'm going to add the new income updated amount. So once I do that, I will then save and exit from my interim. And then I'll go into the services and add a service for case management and make sure that I provide the PATH-funded service field, something from that drop-down box so it gets corrected. So you actually get 3 different data collections there. You're going to get your contact, you're going to get any of the updated income information, and you're also going to get a credit for a service, PATH-funded service as well for that. So I hope that answers your question.
Yes, thank you.
Okay, so we got a couple more questions popping up. Margarita asked, so when our clients get housed from the shelter successfully, do we still put an exit date? Because we still do home visits for some of our clients for up to 1 year.
Okay, so that would be the option number 2 that I had on the PowerPoint for exiting clients. It could also be an option 1 too, depending on if you as the PATH provider feel the need to continue providing those services once they're in another homeless program. But you do not need to put the exit in and put them in as successfully completed until they're actually discharged off of your caseload. So that, as you as the staff or the management of that program need to make the determination on how long they're providing those services. And if it's up to a year, then you would wait to do the exit information once they actually decide to discharge them from the program and not do the follow-up visits. If I'm understanding your question, then that's how you would do that particular example.
Yes, that's it. You answered it.
And a follow-up to that is, what were some of the examples you gave earlier in the presentation for residential and non-residential sites?
All right, I think you're talking about with the outreach sub-assessment for contacts, that location drop-down. You have 3 options. 1, place not meant for human habitation, which we all should understand that. residential service, what is it, service location residential, I think is how it's put in there. Residential would be, say, a community center of a housing, like say you have a housing complex that's all low income or permanent supportive housing, or they all have vouchers or something like that. Then the community center would be a service setting that is designed for the residents of that complex. So usually it's any type of setting that is designed for services for a particular residential project, where non-residential service setting would be a soup kitchen, even a shelter, because when they say residential, they mean living there, not just temporarily residing. So a shelter, soup kitchen, maybe if you have just a service agency, we have one here at the beach called Helping Hands of Myrtle Beach. They provide like bus tickets, some food, like a food cabinet, things like that. That would be a service setting, non-residential as well. Or an outreach event that you maybe go to a community event, that would be a service setting, not residential as well. Like maybe it's just like an event that the community is doing for a bunch of homeless providers. Then you as an outreach worker, if you were there and met somebody that was your client, it would be a non-service or a service setting, non-residential.
Hey, Kyle, this is Michelle. The only thing I'll add to Margarita's first question is for everyone to keep in mind that until that client is exited from the PATH program, that it's expected that all services and updates and referrals are tracked at HMIS until they're exited.
Okay. Okay.
Great. Thanks.
Thank you.
That is all the questions in the chat box, unless anyone has any last outstanding things to ask. Okay. Not seeing anything come through. We just wanted to remind you, as Kyle mentioned at the beginning of the webinar, that we will be sending out a training recap just to be sure that you kind of got big points, because things have been changing with HMIS and reporting, and it's just kind of been a moving target. So Helen has pulled up a screenshot of that with the bright purple banner at the top. The instructions are on there to answers submitted by the end of day tomorrow, so 5 p.m. tomorrow, Friday, and it'll automatically populate to us. And if there are any particular pieces that we see people are still struggling with, we'll do some follow-up with that. The goal is to have at least 80%, I think 80%, Helen, correct answers on.
You want 100.
We want 100, of course. Of course, we're all major achievers around here. But 80 is acceptable. So that's what we're hoping for. So it's just quick questions, true, false. So it shouldn't take more than a few minutes. Unless Kyle and Helen have anything else to add, either of you?
No, Helen, if you just put up that last slide so they can make sure, just in case they don't have the contact information of their HMIS administrator. Again, we will be sending this out, so you will have it, but I just want to make sure if you have any additional questions that you don't think of at this time, because it's a lot of information, takes time to process it, please contact your system administrator for your continuum of care. That's me for ECHO, Cecilia for LHC, Helen for MOC, and Natalie for UHC. And we'll do our best to make sure that we provide adequate feedback in an appropriate amount of time. Some of us also have help desk tickets as well that you can do probably from the website. So I just wanted to put that out there just in case anyone didn't know who their system administrator was, so they can have that contact information. We really appreciate your time. We know this was a long webinar. We hope that you got something out of it, and it will be recorded and sent out so you can watch it again, or for any of the staff that were unable to be on the call. Just thank you all so much for what you do in bearing with us through the time of all these changes with PATH and HMIS. We're all trying to work to make this a process that collects the information that we need to keep our programs and to serve the populations that we do serve, but also to be able to do it in a way that makes it easier or most, I forget the word I was trying to use, but basically that we have the easiest workflow possible out of the information that we have to collect. So let us know your feedback if you have any for the next webinar. We, you know, if we decided we're going to do this again and we like this, then we'll keep doing it. So provide us any feedback if there was anything that you think we could do to better this this experience. So thank you all.
Great. And I just wanted to say thanks again, everybody, and everyone involved, including the past staff out there. Let me know as well if you have any questions at all. So thank you so much. Bye-bye.
Thank you to Kyle and Ellen and Natalie for preparing this. Thank you very much.
Have a great day.
Thanks, Kyle.
Bye, everybody.